Hi, I'm Dr. Ketan Mody. I'm a sports medicine specialist with an office in Westmont and Orland Park. I'm on staff at Advocate Good Samaritan Hospital, and today we're going to talk about concussions. I've been treating, diagnosing, and studying concussions for the last 10 to 11 years. I'm constantly looking up research to make sure that I am on top of all the latest research so that we can properly diagnose and treat our concussions. Concussions are actually called mild traumatic brain injury, and that wording is very important. Mild traumatic brain injury. It's not a serious brain injury. However, the fact that you injure your brain means that there are long-term consequences that could occur from concussions. What you need to be aware of and look out for in either your kids or your family members or the kids that you coach is that some of the stuff that occurs when someone does have a hit to the head. So if someone either hits their head on the ground or two helmets hit, and one of the kids is what we call woozy, they have trouble getting up, they're stumbling as they get up from the ground, they may complain of a headache, they may complain of dizziness, they may say they got their bell rung. So now we want to know, what do we do once a concussion happens on the field of play or on a court? One of the things that needs to be done is immediately the athlete needs to be taken out of the sport and put on the sidelines. They need to be watched very closely by a medical personnel, a coach, or a parent. We want to look for signs that could indicate a brain bleed, which is very rare with concussions, but can occur. Those symptoms are stroke-like symptoms, pupil being bigger than the other pupil, slurred speech, constant dizziness where the patient or the athlete cannot stand up. Those would indicate an immediate transfer to an ER so that we can get a CT or an MRI to look for a brain bleed. One of the misnomers of concussions is that we can get them back to sports within a couple days, as they do in some of the major sports leagues such as the NFL. The truth is that it takes more than 7 days usually to get through a concussion. It is very important that we know how to diagnose and treat concussions properly in order to keep our family members and community members safe.